Ghana, like other tropical countries, is endemic with a number of neglected tropical diseases that, if not addressed, will derail the gains made in public health. It also has implications for the development of the country. For this reason, various NTD programs have been created to help citizens of our beloved country to take the necessary precautionary measures to prevent the spread of these diseases, manage the morbidities, and if possible, eliminate them from our communities. On the show today, we're discussing the observance of the third World NTD Day, which falls on Monday, the 30th of January 2023. Dr. Joseph Obari is the Deputy Programs Manager of Neglected Tropical Diseases. He's joining us in studio. Good afternoon to you, sir, and welcome to the Pulse.
Thank you very much.
For those who may not be aware of NTD, just by way of education, help us understand and appreciate what it is all about.
Okay, thank you very much. Neglected Tropical Diseases, okay, basically stands for the acronym NTDs. And these are 20 preventable and treatable diseases. For Ghana, we have 14 of these conditions. NTDs affect about 2 billion population worldwide. And in Ghana, in every district, we have about 2 of these conditions. Unfortunately, these conditions disfigure and disable. And because of that, people may not be in gainful employment, and students may not be in school as expected. Some of these conditions are river blindness, normally we call it onchocerciasis. We have bilharzia, okay, or schistosomiasis. Then we have lymphatic filariasis. We have yaws, you have Brody ulcers, you have trachoma, and so forth. Good.
So these are some of the conditions that are unique to where we find ourselves in the world.
Exactly.
So what's the status of, for instance, Ghana now as a country in terms of combating some of these diseases?
A lot of work has been done, right? And I can say that when we take conditions like onchocerciasis, through the support of Ghana Health Service, partners, and also community members, about 90% of this condition, the condition has been reduced to about 5%. When we take lymphatic filariasis, the burden has been reduced, right? As at now, we have only 8, I should say, districts that we are fighting these conditions.
Right.
Formerly we had 114 out of the 260 districts in Ghana, right? So a lot of work has been done. Trachoma has been eliminated, right? And soil transmitted helmets, okay, it's also reduced drastically, and a whole lot, yeah.
But it appears that there are some that we're not paying attention to as we ought to.
Yeah, I should say that most of these conditions, what I've mentioned are those that we've really made good strides in.
Right.
But some of these conditions are still pending, right?
So we're still neglecting some.
Yes, yes, because when it comes to the global health agenda, NTDs are not normally considered per se. Then also, even we don't have direct funding for these conditions, to manage these conditions, had it not been the support from partners, right, and so forth. So this is an opportunity for us to talk so much about these conditions so that we shall get more support. People who may know of their conditions come out from the neglect and make sure that these conditions are treated.
For instance, are there some unique diseases that you're paying attention to, say, this year?
Right, all the 14 conditions that I've mentioned some already. So although we have these conditions, the prevalence has gone so low, we still want to end NTDs. We want to get rid of all the neglected tropical diseases from Ghana. And that's what we are hoping for, so that by the year 2030, there wouldn't be any neglected tropical diseases conditions in Ghana. We
know that you're marking this is supposed to be the one, yes, on the 30th, which is happening.
Yeah.
What are you reflecting on as you mark this celebration?
Right, it's going to be so interesting. We are saying that we should act now. Okay, all hands on deck to combat NTDs. We should act together. One person cannot do it all, and we also have to invest in neglected tropical diseases, in the management, when it comes to health education, and others in other areas. And those who have these conditions also, we should be able to manage them in diverse ways. We have to train community volunteers, we have to train health workers, and so forth, right? And also we have to invest in wash facilities, because if you have water, potable water, and good sanitary conditions, no open defecation, of course, you wouldn't be affected by conditions like schistosomiasis and so forth.
The general public itself, because very often when we talk about health, people see, well, the effort should just be coming from the side of the experts.
Okay.
How are you seeking to get support from the general public as well? And what can people do to equally throw more light on these neglected diseases, create more awareness and be part of the process?
We want everybody to be on deck, and all hands to be on deck, right? General public, we want you to talk more about neglected tropical diseases. If you have any of these conditions, please don't shelve it. Come out, let us know. Visit the health facilities so that your condition could be captured, right? We shouldn't open defecate, all right? Then also we must make sure that we have potable water, because most of the sources are from these conditions, these amenities, right?
So obviously you cannot do this alone just from your outfit.
Exactly.
I'm sure that you're working as a team.
Exactly.
How are you doing that, and who's on board with you?
Right, we have our partners. Okay, we have FHI, Act West, supported consortium partner. Right. We have Site Savers helping us. We have Water Aid, right, and World Vision, and so many. WHO, of course, that is the main technical support team you have on board, right? So all that we are saying is that we need to end neglected tropical diseases. We should act now, act together, and invest in the management of and prevention of neglected tropical diseases.
Right. In the coming days, are we likely to see any special program that you'd roll out just to create more awareness on some of these conditions?
Sure, we should. On Saturday, there's going to be a health walk, which you are invited.
Oh, you have some activities already.
Yes.
Right.
And also, all the Kife clubs in Accra, we are calling you. Come at 6 o'clock to the Ghana Health Service, the main building at Kolebo, right? We are going to assemble over there. You walk to the headquarters of Ghana Health Service with our placards with so many messages. Then on Monday, there's going to be, that's when the great event is going to happen at the Ghana College of Surgeons and Physicians. We are going to be there, right? And shall talk more about neglected tropical diseases. So come and help us. Come and listen, go and do more education and invest in neglected tropical diseases.
In a few minutes from now, we'll be of course focusing on one of those conditions that's got to do with the Buruli ulcer. Yes. I guess it's part of that category. For those who do not know about the condition and what I mean brings the whole condition about, how do you throw light on that, and how do you create awareness for more and more people to know that indeed some of these conditions exist, and if you don't avoid some of these factors, you may be a victim to what's happening?
Right, basically, Buruli ulcers affect the skin. Okay, it's caused by bacteria, affects the skin. As to the mode of transmission, right? Okay, it's a bit difficult, dicey to say it.
So, okay.
But obviously, when you have the condition, you see the ulcers all over, right? And these ulcers must be managed. They are not ulcers that within a short time you could manage. You need an expert, so you must visit the health facilities. So if you have any strange ulcer on your skin, make sure that you get to the nearest health facilities. A test will be done, and from there we take it up.
And just like any other neglected, tropical diseases, the NTDs, I should say, are you opening up some special centers within public hospitals? Just as a way of creating awareness and getting people to freely report themselves?
Right. We have, it's the normal OPD, right? When you get there, right, you go and tell the doctor, the nurses, your story. And from there, if it is a neglected tropical diseases, of course, it's going to be diagnosed and we take on the management. Are
you doing some special coverage for those who may find themselves in that category, together with your partners? Providing some relief or respite in terms of the cost of treatment?
No, most of these conditions are captured by the health insurance.
Oh, okay.
Right. So that is it. It's an integrated kind of approach, management. So we expect that if you have the condition, just go to any nearby health facility, of course with your national health insurance. Even if you don't have it, just go there. And there'll be a solution, there'll be a way out. Because we need to get the conditions and manage them. Yeah.
As we wrap up, what would you want to let the public know as we look forward to the 30th, where obviously you'd be engaging the public more on NTDs? What special message do you have for them?
Right. The special message is that all hands should be on deck. We should all act now. Okay? We should act together and invest in the management in the prevention of neglected tropical diseases. 14 we have in Ghana. And by the year 2030, we wish we could get rid of all these conditions. Yeah.
So that's the target.
Exactly.
We hope that we meet that. But Dr. Opare, I'm grateful that you've been able to join us. But we're staying on the health front because